Hey everybody, David the AI Guide here. Welcome to another episode on the AI Guide where we're making AI human. At the end of each hospital shift, the outgoing nurse has to quickly bring the incoming one up to speed about all of the patients under their care. This handoff can take multiple forms, including conversations, written hand notes, and electronic medical records. So one of the biggest hospital systems in the country is HCA Hospital Corporation of America, headquartered in Nashville. Michael Schlosser, Senior VP of Care Transformation and Innovation for HCA Healthcare, said, "We have to make sure that the handoff is done in an accurate way and that nothing falls through the cracks." Why? Because people can die, right? Schlosser and his team thought this transfer of information could be a good opportunity to apply generative AI. But when HCA scoured the market for potential vendors, Schlosser says they couldn't find any companies building solutions for the handoff issue. HCA had an existing partnership with Google Cloud, so they turned to Google software suite called Vertex AI, which helps customers build and deploy machine learning models. Google has also been developing a healthcare-specific LLM, large language model. This renewed push into healthcare comes as Microsoft and Amazon are making their own AI-powered inroads into the sector. Why? Because healthcare is one of the biggest pieces of both the U.S. and global economy. Hundreds of billions, probably trillions globally are spent on healthcare. We're still 5 minutes into the marathon, Gartner analyst Ducati says of the healthcare AI landscape, meaning we're at the bare beginning of this. Google's recent AI solutions in the industry are geared towards solving piecemeal problems. For example, Google released AI tools last year to help healthcare organizations read, store, and label X-rays, MRIs, and other medical imaging. And my viewers already know that an AI can read all those better than a person can. The focus on specific use cases is necessary because of where AI technology itself is at, said Greg Corrado, head of Health AI at Google. In practice, these systems always require identification of specific use cases. So that has not changed from the very beginning, still to this day. In 2022, Microsoft acquired Nuance Communications for $18.8 billion, giving it a major foothold to sell new AI products to hospital clients, since Nuance's medical dictation software is already used by 550,000 doctors. That's stunning market penetration. Before the generative AI boom, Amazon, Microsoft, and Google were all competing for cloud customers. It's also no surprise that they are all now trying to specifically target healthcare, a complex and heavily regulated industry. Ducati says that's because if you're able to prove use cases in a more complex environment like healthcare or financial services, then it signals to other customers that generative AI is ready for broad adoption. So this is really important. They are cracking the hardest industries first to allow generative AI business applications to roll out to all businesses. So with regard to healthcare, no one is there yet. Applications are being built by customers, but what the customers, meaning hospitals, really want are fully built solutions. Clearly, only the very largest hospital chains can be making this kind of investment because it's so expensive. Amazon, Google, and Microsoft are fighting it out, but none of them have articulated a good enough comprehensive story. Because healthcare is so highly regulated and the consequences of mistakes are high, generative AI use cases need to start out very small. For HCA, that means at only one of its 180 hospitals. Their UCF Lake Nona hospital is currently piloting the handoff tool. The AI ingests patient data from the past 12 hours, including lab results, medication, important events, and spits out a transfer summary. Schlosser at HCA says, we're actually doing a lot of head-to-head testing right now to see where does the generic model work better versus the medically trained model, which provides more accuracy and better outcomes. The idea of using multiple models to solve a complex problem known as composite AI is what they're doing. So this is a new concept. Ducati of Gartner expects that more and more will start to see Google, Microsoft, and Amazon start offering services to help customers be able to evaluate different models. Corrado of Google says that at the state of the art right now, generative AI models can be likened to an eager, studious assistant that's trying very hard to do a good job. But you should view the output critically. OpenAI has taken the view that bigger is better. For example, GPT-3 had around 175 billion parameters. GPT-4 is believed to have 1 trillion parameters. Google says their largest models have 540 billion parameters. But as models are trained on more and more data, there can be issues with their performance. In July, and I talked about this before, a group of researchers at Stanford and UC Berkeley said their test suggested that GPT-4's performance had suffered, that it degrades over time. One of the biggest problems in healthcare for these algorithms is going to be the difficulty they have with transparency, meaning proving how they came to a conclusion. Corrado says these concerns are precisely why Google is experimenting with niche LLM models that are trained on smaller data sets. You have to do the same kind of rigorous quality evaluation and version control that you would expect from a real commercialized product, said Corrado. So AI is going to evolve into being like Apple's iOS software, where a new version regularly comes out. Another challenge for most LLMs is that they're not constantly learning. For example, ChatGPT was only trained on data through September of 2021, but knowledge in healthcare is always advancing. In the hospitals of the future, Schlosser envisions an AI assistant to the care team that he believes will have amazing power in reducing the administrative burden. HCA has also been working with Google and publicly traded ambient AI company Augmedix to automate medical note-taking in the emergency room. The holy grail for doctors, he says, is that they could focus on providing care to patients and documentation would take care of itself. So in other words, all the notes that doctors are currently having to type into computers, gone, completely gone. The reason they're starting in the emergency room is because that it is one of the most complicated venues to prove that technology actually works. So if it works in the ER, it'll work anywhere in the hospital. When it comes to using Augmedix's tool, the doctor directly asks the patient for their consent. For the nurse handoff tool, which is not patient-facing, consent isn't required. Schlosser says HCA will have to consider the right way to let all patients know that an AI is part of their care going forward. But Google, that HCA uses, has siloed all of their customers' data, meaning it's not shared between customers. HCA's data is HCA's data and nobody else's. Think of it as a vault in our cloud that is only used to train the version of the model they're using. HCA is taking a slow approach built on alleviating some of the burdens of doctors' and nurses' day-to-day jobs. Said Schlosser, I want clinicians to fully embrace AI as a partner that's making their life easier before we start getting into some of those more controversial areas. So that's a great place to segue into a wrap-up. So what did we learn here? AI is going to evolve into standardized software like Microsoft or Apple software. That's what's starting to happen, and that process will accelerate. so that AI software will be released in versions like all other software. Secondly, they're tackling the hardest areas first to broadly roll it out. Thirdly, the AI being developed right now is cobot AI software working with doctors and nurses. But that very last sentence that I said shows that eventually they understand AI will replace doctors and nurses. Robotic surgery, robotic intake, meaning you walk into the ER and a robot will take all your symptoms and diagnose you. But for the foreseeable future, there still will be hands-on needed because people, especially when they're sick, want that. That means that while jobs will be eliminated, not all of them will be. So thanks for tuning in. Please like, subscribe, and share. Really important to help us get over 1,000. Also, get the free resource. The resource is free. Learn more about AI before you, like all these doctors and nurses, will have to start using it all day, every day at work. So get the resource. Thanks so much. Take care. Bye.